Dolly Monceau being moved from the COVID ICU to a regular COVID bed.
Tell me when.
The 82-year-old thinks she got the virus from a family member.
You don't know you're going to get it, and then you get it, and you're sick. And you don't know if you're going to live or die.
Unvaccinated, she says she was on the fence about getting vaccinated. Today, her mind is made up.
All my family wasn't going to get the shot, but now we are.
All your family?
All my family.
57-year-old Ronnie Terrell has been in the hospital for more than 2 weeks. Breathing, still a chore. Also unvaccinated, he just didn't think he needed it.
I just never got around to it. I've been healthy for 40 years. I hadn't had a cold in 40 years.
He thinks he got the virus at an outside event.
Did you think COVID was not a serious illness?
Well, I didn't give it that much thought because at the time it wasn't that big a deal, when it first started,
And what's your thought on it now?
It's a big deal. It's a big deal.
Mississippi suffering its biggest spike in cases yet. Hospitalizations more than ever. So many cases so quickly, the trend line nearly vertical. The vast majority of cases, hospitalizations, and deaths all among the unvaccinated.
I think what's most interesting is the detachment, the complete lack of connection in what you see out in the community with what's happening in these hospitals.
Pascagoula's Singing River Hospital can't expand COVID capacity fast enough. It's cleared beds to serve more COVID patients, but doesn't have the staff to open it. The beds sit empty.
It's exhausting, both mentally and emotionally. I think the most difficult thing emotionally that we're having to deal with now is what do we do with these people who've been on the ventilator for weeks and weeks and weeks and aren't getting better?
There is a small ray of hope. The vaccination clinic here is seeing an uptick in those getting shots into arms.
We were still just starting to ease into our normal life, and then the Delta variant, and then we're like, okay.
Edna and Thomas Baria were most concerned about the Delta variant and making his already complicated health situation even worse.
That would be wonderful to get back to normal.
19-year-old Isabel Smith got such a bad case she could barely get out of bed.
Right. So when you got sick, how sick did you get?
On a scale from 1 to 10, probably an 8.
She now wants to get vaccinated as soon as she can. Her mom, who is vaccinated, thought her daughter, who has asthma, might die.
Whether or not I was going to have her on a ventilator when I had begged her to get the shot, and I told her, I'm backing off. I've done all I could do.
Singing River Hospital also has a monoclonal antibody treatment site for outpatients who have the virus but don't yet need a bed.
And what is the level of demand for this treatment right now?
Literally the phone is ringing off the hook. Again, we're trying to do 200 a day. We could probably do 400 a day with the demand that we have right now.
The hospital expanding the treatment site into what was once a waiting room. The treatment, while good, isn't as good as being vaccinated and preventing the disease from taking root.
This is not a replacement for the vaccination. That's the most effective way that we're going to get through this pandemic is through an effective vaccination campaign. Regeneron is strictly for those that are already positive.
Amanda Dunning, 35, was unvaccinated. Thinks she got it from a friend while shopping. Now she'll get vaccinated as soon as possible.
I'm convinced. Please just get the vaccine.
You've gone 180 on
Absolutely, I did a 180.
All right.
And it's because of getting COVID.
While not a cure, the antibody treatment is keeping the sick from being admitted to the hospital, but it has to be administered by healthcare professionals. Edith Jordan, 64 and unvaccinated, thinks she got the virus at a family event. Okay with an IV drip for an antibody treatment, she still doesn't trust the vaccine.
I'm just not trustful of the data.
Which data?
I'd rather not say. It was just a personal choice.
Vaccine refusal sickening people throughout the South, ripping through South Mississippi.
What is COVID doing to your community?
It's killing us. It's killing our residents. It's killing our demographics. It's killing the staff emotionally. It's a complete overwhelming situation.
The emergency department so overwhelmed here, patients sometimes wait days for a bed to open up in the hospital. A deepening crisis with no end in sight. Miguel Marquez, CNN, Pascagoula, Mississippi.